And we're live here. Oh my gosh, we've had so much technical issues. Roxana, you're on. Jessica, you're on. I'm so grateful. Thank you guys. I'm going to need a second here to get all set up. The live link that we had initially established for this show, for some reason, was having some technical problems. I know you guys were telling me and alerting me about it way before I even started. So let's just get this show kicked off here. God, what a way to start our special. Um, Here, thank you guys for your patience here. Let me see if we have our guest in. Besides, yeah, there's one. Okay, we're going to invite Jessica in, and then we're going to invite Roxana as well. And we'll just get this show kicked off. Roxana Chicas. Let's see here. Hey, Jessica, how are you?
I'm good. How are you?
I'm sweating. I am sweating because I'm like so flustered by all this stuff here. But I'm so grateful you guys are staying patient with me, and Roxana and Jessica are both here. I usually take a couple minutes to like allow people to join in and sort of like build up the crowd and the audience, but I was having so many technical problems. I thought, let me just start it to get underway. So if you want to stay with me here, I'll just start the show. Hey everyone. I'm Nick Valencia. I'm an independent journalist. Welcome to the latest edition of Nick Valencia Live, where today we're joined by two very special guests, and we'll have some special guests, more of them joining us in the back end of the show. But we thought we would focus on the state of public health in America. Along with journalism, the media, press, however you identify it, it seems like one of the industries in the United States right now that is currently under attack, that's being singled out by Trump administration 2.0. There's a lot of misinformation, a lot of disinformation, a lot of parallels between what is happening with the attack on our First Amendment rights and the really one of the pillars of democracy in this country with journalism, and also with public health in this country. I think a lot of you guys that are watching, you all know that I spent a lot of time reporting on public health during the pandemic. You also know that my wife is an epidemiologist. For full disclosure, she works at Emory University. She works getting grants with the CDC and NIH. That's for full disclosure here. It also means that we're very sensitive and we care a lot about what's happening with the state of public health in this country. And we're joined by two very special guests here. Jessica Malaty Rivera, she is a leading infectious disease specialist and epidemiologist, and she became really one of the most trusted voices in public health in the country and the world during the pandemic. We also have joining us Roxana Chicas. She is an assistant professor at the nursing school at Emory University, and she's a national fellow at the American Medical Center. Is that right? Did I get that right? Medical Academy? Is that right?
National Academy of Medicine.
There we go. You guys are smarter than me, which is why I have you on the show. And let's kick it off here and give the first question to Jessica. Jessica, when you think about public health in the United States today, what comes to mind?
Oh, wow. That is a very heavy question. Unfortunately, it's not easy to answer because public health, even prior to COVID, has always been very decentralized. Because of how our Constitution is written, public health is a state issue. So it's difficult to even have standards for data and standards for testing and standards even for policies and requirements because the systems are designed so that each state designs that. Now, you're seeing one of the consequences of that in real time as states are deviating from scientific recommendations, with Florida being the first and probably not the last to walk away from, evidence-based recommendations on the pediatric vaccine schedule. I mean, public health has chronically been underfunded. It has chronically been undersupported. And I think a lot of things since COVID have proven that, excuse me, public health, when it works, is a pretty invisible labor force. And it requires a lot of investment for it to kind of maintain healthy equilibrium in our population. When you start to defund it, then you start to see these fractures, you start to see these breaks, and then epidemics become more catastrophic than they intend to be or than they should be. So much about public health is harm reduction, and it's about prevention. Instead of being a reactive system, it really is intended to reduce the outcomes that we expect could happen if we don't have these interventions. So it is unfortunately not in a good place in the United States right now.
Roxana, it has trickled down to the hospitals. It's trickled down into our medical research institutions. What kind of impact and effect are you guys seeing right now at Emory University, or you in your personal everyday life?
Well, we are having to, there are some researchers who are having to just completely abandon their research, right? Because it's no longer funded. So we are having to try to pivot or figure out how we can continue doing that research that is still so critical and part of public health. And, we're also recently the MAHA report was released, right? So there's now a different shift into looking at lifestyles, nutrition, which
Yeah.
was something that we were looking at before, but now, this new report is really emphasizing that this is what they're interested in. So the infectious diseases are not so much a priority anymore.
What do you see? What do you guys see as being the priority right now, other than sort of, trust me, believe me, I'm telling the truth. That's what kind of it seems like. What do we trust right now, Jessica? Who do we trust?
It's what it seems to me is what they're signaling is that it's ideology and not evidence. They're presenting themselves, and I use the word they to describe Maha and the Maha movement, as asking questions that they would make it sound like they have never been asked before. But as my colleague here says, these are things we've been exploring for a long time, including the chronic disease crisis in this country. But what is often not included is the fact that infectious diseases are a leading cause of chronic diseases. And so this trust battle of who's asking the right questions and what the sources of the answers might be has made it very, very fraught and very contentious. In fact, they just updated the CDC website yesterday with a ton of language related to restoring trust. And so it's not like they haven't caught on to the broken trust issues that myself and my colleagues have expressed for quite some time. But now it's a battle for that trust. And unfortunately, it's going to be comparing evidence based recommendations to ideological based recommendations.
Is that how you see it as well, Roxana? Because some of the things that they say, just sort of when you talk to somebody on the everyday street, let's get the dyes out of foods. Let's make our food in America cleaner. And that all sounds like something you can get behind until you start to peel back and look at the details of this, like Jessica said, the ideologies.
Yeah, I mean, I think it's good that we're asking questions, and maybe these questions that other people are raising. I think they've been studied, but they want to focus that on that again. The thing is that they want to raise these questions, right, and say that this is the focus, but they don't really lay out a strategic plan on how to do this, nor do they really tell us the reasons of why certain changes are happening.
Hmm.
So, for example, with vaccines, there's no, and so it's ignoring a lot of the sciences that's out there, and I think the biggest crisis is the misinformation, disinformation, trust that's happening. That is the huge public crisis that we're dealing with now, and how we're going to repair that. It's going to take a long time.
So let's pick up there because there are so many everyday Americans who don't have access to people like you and their phones. They're not married to a smarter person, an epidemiologist, or somebody that they know has fact based research and science. Where are you telling people to go right now? Are you encouraging people to go and look at what's on the CDC website, federal guidelines? Are there other places that we're supposed to go now as Americans that you all see as sort of really still doing the work and putting out trustworthy information?
Nick, it's really heartbreaking that I even have to question sending somebody to a website that ends with cdc.gov. It is a very, very distressing time because even though I have disagreed with CDC guidelines throughout COVID on a number of occasions, I was never willing to throw the baby out with the bathwater and say that
Right.
they were completely untrustworthy because disagreements can happen, even within the scientific community. That's part of the scientific process is to be iterative and to learn and to
That's part of the
adapt.
discussion, right? The
It's part of
dialogue.
the discussion. But now we are dealing with a hijacked agency. I think what happened with the firing of the CDC director and then the kind of related resignations of three very important people because they had been iced out of very key conversations organizations tells us that right now it's been compromised. I fear the future of that website come Friday after ACIP has adjourned. And so as a result, I'm sending folks to organizations that continue to be driven by evidence: the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, CHOP, Mayo Clinic, Johns Hopkins. There are still a number of organizations and institutions and individuals who will continue to do that. That's why you're seeing this West Coast Alliance come up with their own guidance as well. You're seeing the same thing kind of happen in the Northeast that just got announced, I think, earlier today.
Yeah,
So
I saw that.
we're not without resources, but it is a very, very dark time in public health that us who have always revered CDC as the premier public health agency are now questioning that.
It's crazy, and you look in the chat, people are just, beside themselves. Like, what do we do? We're so used to going to a website to have information, whether it's, guidance as new parents, whether it's,
Yeah.
school guidance of what to do with kids or how to talk to kids, adolescents. I mean, we live in an area here in Atlanta that is saturated with public health professionals. So it's sort of mind-boggling to me, Roxana, that they're being singled out as being the bad actors. I know my friends in this community. I know my neighbors are moving in good faith. They're not waking up every day and saying, how can we make this science more politicized and make Trump look bad? Or how can we, make the curry favor with the Democrats? That is not what public health professionals do. In fact, what was surprising to me during the pandemic is that we saw so many front and center come out. It's a sort of job where you kind of stay behind the scenes. You're not for glory or attention, but now, it's like these public health professionals in the country are being singled out, Roxana. What does it feel like?
Well, it's scary, especially since we had a gun violence at the CDC a few weeks ago, right? So it's quite scary. And gun violence is going up. So I think that a lot of public health professionals, we do, and also for researchers and anyone who's in academia who we straddle kind of both worlds, is it's very alarming and concerning and wondering, like, will an attack happen here today? Is it okay for us to continue to speak out and follow the science when now, like, who would have thought many years ago that it would be almost dangerous to be in public health?
Right? It's like all of a sudden you're a controversial person.
Yes.
I think about it relating to my industry and think back in my days in college. I never thought I would have to go to a domestic gathering with security. And now you, as public health professionals, must think, when did we become the enemy? When did that happen, Jessica? When did all of a sudden public health professionals become the enemy in America?
Yeah, I mean, it happened during COVID. I remember very, very angry, vitriolic language coming out about Dr. Fauci. And Fauci, I think, probably was public enemy number one, or at least most popular public enemy for quite a while. And then anybody who agreed with him or anybody who was part of the establishment of science in which RFK Jr. has continued to vilify. He calls the CDC a cesspool of corruption. I mean, he accuses CDC people of killing children. I mean, it's just horrifying, inciting violence type of rhetoric.
And this is our
And
HHS secretary who's using language like this to describe good faith people in public health.
exactly. Exactly. I mean, it didn't help too that you had a number of antagonists during COVID who were also writing books and blog posts about these folks, making all kinds of, ad hominem attacks and slanderous claims about them. I mean, myself included, and I'm not Dr. Fauci, but I had a number of people who were saying very violent and hateful things to me in my direct messages in my inbox. Thankfully, never in person, but I've always argued that pandemics are the most destabilizing thing that can happen in a population. I would argue that it's even more destabilizing than war, because if you have got a pulse, it doesn't matter where you are on this planet, you are vulnerable. And I think it is a very scary time. I think my tolerance for that was probably a little bit higher because I'd been studying and anticipating pandemics for so long, that my tolerance for that kind of chaos and destabilization was higher. But it's not to say that people were not severely impacted by it. I hold a lot of space and empathy for people who struggled with mental illness or lost jobs or couldn't see family or lost family because of COVID. And so because of all these traumatic experiences that happened so acutely in this 5-year period, I understand big feelings. I understand even rage. But it has set us down a very scary path when people in power are adding fuel to that fire.
I had 3 members of my family take their life during the pandemic. It was an incredibly
Wow.
difficult time for me. I struggle with anxiety and PTS, and I had just started anxiety meds in January of 2020, and I was starting to build some confidence and really feeling good. And then the pandemic happened, and we saw the worst of society. We saw the very worst of people
Yep.
come. I saw things that I never want to have to see, right? I know you guys did too. How is it, Roxana, to step up for a community, for a country who now questions your very job or whether or not you're qualified to do your job? How is it to treat people or to just sort of give guidance to people who they're playing Google doctor, right, with you, and they're trying to come across as being more educated than you are because of this broad strokes generalization about people like you?
It's heartbreaking. It really is heartbreaking because we just want to stop people from becoming patients. And we want to keep America healthy. And so to feel attacked, yeah, it's very heartbreaking. It's discouraging. But I think that we can't let those feelings take over us, and we have to continue um, speaking the science, speaking the truth, and continue, all of us that can doing our job, because eventually I think, there are people still that trust us. There are still people who count on us. And I think it's important that we remain steadfast, committed into public health and, you know, keeping people healthy. That's our only goal, right? The goal is very simple: to keep people healthy.
Mm.
Jessica, the same question to you because you're out front and center. I mean, you have 500,000 followers. You're literally, I'm not blowing smoke. You're one of the most trusted people in public health. You're, a trusted voice. How is it to go out every day to track down disinformation, to try to inform, misinform people? It must be so fucking exhausting to really just show up every day in good faith and be met with this resistance.
It is. And honestly, there are times when I want to quit, but then there are moments that I look in my inbox and my DMs and I see that the good outweighs the bad. It's very easy for me as a sensitive person to focus on the bad. But I know that the good outweighs the bad. I know that the work that we're doing is meaningful. It is changing minds. It's not just screaming into the void and screaming on the internet. It is changing minds. It is helping people go from fear-based decision making to informed-based decision making. So when I feel despair, I kind of go back to those messages and remind myself like to stay on course, to be activated and focused, because how else are we going to get people to like she said, not be patients? It's through evidence-based, empathetic, repetitive, consistent communication. I mean, science needs communication. It's not done without communication. And I think that for folks like us who have that kind of language ability to translate it, to make it make sense to folks, are more necessary than ever.
Yeah, absolutely. And chat, we really want to encourage you guys to add some questions. You have 2 very experienced, very knowledgeable, badass Latinas here in front of you, giving you the truth and sort of the reality of what's going on in public health. I want to pivot to the Latino community. I had a guest on a couple weeks ago now who says that they were very concerned with with Medicaid and the impact Medicaid cuts are going to have on the Latino community. They threw out a number of somewhere around 70 million Latinos on Medicaid. And then most of those Latinos being young children who are on Medicaid. What do you know about this? What can you tell me about the threats to Medicaid and potentially the impact on the Latino community as a whole?
So I think that, for one, this administration has been known for trying to have a chilling effect on the community so that they do not access services that they're entitled to, like they have a right to, like Medicaid, children who are U.S. citizens born here. And so I think that the most important thing is for us to keep reminding parents that, U.S. children can be on Medicaid, and encourage them to continue to apply so that they continue to, be able to have access to healthcare. And I think it's also important to note that if you are undocumented, you can't be on Medicaid. It's that simple, right? Like, you cannot be on Medicaid. And that's something that many people have tried to use to make it seem like undocumented people are receiving all of these services for which they don't qualify. That as soon as you pull out the application, it asks you for your immigration status. You have
But
to
it's like
provide evidence.
it's like this fact doesn't matter to people. They have these stories made up in their mind. This is part of
Yeah.
the challenge that I deal with in being, like Jessica said, a communicator, right? Like, we are not brain dead megaphones. Please, we're here to help. Public health is an act of service. Journalism is an act of service. And it just gets so frustrating. Like, we're like speaking into the void sometimes, you know?
Yeah, despite the fact that the data are so clear, I mean, almost half of children benefit from Medicaid in this country, right? 40% of children born in this country who are from rural or underserved communities rely on these benefits. Not to mention the fact that SNAP benefits are one of the best ways to keep kids and families healthy. And when we talk about some of the poorest outcomes related to people's health, it's because they live in food deserts or they have food insecurity. And if we want to be focusing on food, these are distractions to be talking about dyes and organic and non-organic and GMO and non-GMO. We're talking about access to food to begin with. Too many people are food insecure in this country. That has direct implications on people's outcomes, including things like chronic disease. But we're just, it's these shiny things, these flashy things, these things that have become really popular in the wellness world are much more exciting for people to scream about than to be looking at the hard data of who benefits from SNAP and Medicaid.
Yeah, like seed oils, right? All of a sudden, we're talking about
Right.
seed oils. We're talking about blue dye. We're talking about, I don't even know
Yeah.
what the hell we're talking about. You know, I mean, what should we be focusing on instead? I love that we're having this conversation about food deserts. What should be the focus instead of these distractions?
Access to food. Access to food,
The
to
healthcare.
fruits and vegetables, and access, and like making it. Food costs is rising.
Yeah.
Right. And the healthy food tends to be a lot cost more than processed food, junk food.
I always say it's expensive to be poor in this
Yes,
country, right?
It's expensive to be poor. It is. It's very, very costly. And it's what's really disingenuous is when people will say they'll compare our outcomes to other countries. In almost every single case, they're comparing the US to countries that have universal health care. And our country is so far from that if that was our baseline, perhaps our outcomes would be better too.
God, I mean, I just got back from Canada last weekend, and that was asking Canadians what they think about us. And it's like, you're supposed to be holding the standard. You're our big brother to the South. Where is the support? Where is the access to healthcare? Why is this misinformation? That's what we're associated with now. We're associated with, as a country, with misinformation, guys.
The US is the largest exporter of misinformation in the world.
And then,
Yes.
Roxana, you end up dealing with it when you see patients, right? Tell me about your day-to-day interactions now, post COVID-19, post pandemic. What is it like? Are the patients different now?
But no, I mean, the patients aren't different. I mean, it's the same patients who we're seeing, but there's a lot more skepticism and a lot more talking about, like, about vaccines, about, everyday things that used to be so common and a given. Um, there's just more conversations that need to happen. And so I think that, like my colleague was saying, it is important that we researchers, experts, know how to translate that language in a way that the people can understand. I think that's really important. Like having these talks, these programs like yours here,
Yeah.
where we're just normally talking, right, having a casual conversation that people
Yeah.
can follow and understand. I think it's amazing.
Yeah.
I'm so grateful to have this kind of conversation. This is the stuff that I couldn't do at CNN. that the mainstream, we do drive-by news in the mainstream media. It's 3 to 5 minutes. Our segment would have been done by now. We would have moved on, right? All of a sudden, you don't get the breadth of knowledge that you offer. And you bring up a point that I really want to focus on. This is something that you talk a lot about, Jessica, on your Instagram and on your lives, is vaccines. What RFK Jr. has done to destroy the credibility of vaccines and to sort of plant this skepticism, this Maha movement. It's not just RFK Jr. I mean, he's our HHS secretary, which is why I bring him up, but it's so many others. So what about vaccines and RFK Jr. changing recommendations? Help me understand what's going on with vaccines right now.
Yeah. I mean, there's a lot to say. And I'll start by saying I am not here to discredit vaccine hesitancy. It's a legitimate sentiment, and there are many reasons for it. I think that, the spectrum of vaccine hesitancy is extremely wide, and it includes folks who have been legitimately ignored and harmed by the medical establishment. It includes people who have historical distrust because of really traumatic experiences. And it also includes people who just don't know better or who feel overwhelmed by the decisions and the amount of data. A lot of the research that I do is on infodemics, which is just an overwhelming saturation of information where people don't know how to navigate from trust to untrustworthy messages, reliable sources and unreliable sources. It becomes very disorienting even for trained eyes. But that is what RFK Jr. and his people have been preying on. They've been adding with a fire hose to the information ecosystems so much information that it has made patients doubt evidence-based recommendations, come in with preconceived notions and sound bites and sticky stats that are really, really scary. If you look at some of the trends in vaccine misinformation, it's very unoriginal. Unfortunately, the vaccine playbook has stayed evergreen for many, many decades. But what they do is they modify it ever so slightly to attack whichever vaccine they're attacking. So claims about fertility, claims about genetic manipulation, claims about autism are not new, but they consistently get regurgitated because those are really, really scary things. And so that's why I have a lot of patience for folks who kind of come in with these same claims. But what's happening right now, Nick, is that we are moving so far away from precedent when it comes to how we make decisions about vaccines. So we went completely out of order with what was happening with COVID-19 recommendations. What RFK and Marty Makary, the head of FDA, did was preempt how these decisions get made by restricting access from the FDA first. Typically, what happens is the FDA will meet, they'll make a decision, then ACIP will meet, and then after ACIP meets, they submit the memo to the CDC director, who then signs and endorses or denies the recommendation. We broke all that precedent by going before ACIP, already restricting access and limiting coverage for the COVID-19 vaccine for this coming year, making insurance companies not know what to do, making states not know what to do, making pharmacists and providers not know if they'll be in trouble from breaking from these recommendations, and making it so that, I know many doctors who have not yet made their orders because they've historically been beholden to ACIP recommendations. So that's why firing the CDC director to fill that position with somebody who was just going to be a yes man. And as we heard yesterday during the Senate hearing, that they needed somebody who would not be an impediment to this plan. And that's what they did. And so unfortunately, as the ACIP is currently meeting, they are discussing decisions that are not based in evidence. And they're even moving away from what we call ETR, evidence to recommendations, which is how we've always made these decisions.
And ACIP, just for some clarity for those who may not know what that acronym is.
Oh my God, why am I forgetting the A? It's the
Advisory
Advisory Committee for Immunization Practices.
We're so used to saying the acronym that we forget sometimes, right? Like, what is it? I got it. Okay. They're instrument. Go ahead.
They're an independent group of advisors. But what happened before ACIP was even meeting was that there were 17 excellent, seasoned, I knew many of them, actual vaccine experts who served on this independent group. They're not CDC employees, they're outside experts. All 17 of them were fired, and they've been replaced by people who are ideologically, not scientifically, aligned with RFK Jr. and his anti-vaccine agenda.
So Jessica,
yeah, go ahead. Go ahead. I
I was
love it,
just going
Roxana.
to
Come
ask.
on in. Jump in.
I just want to ask her what her thoughts are because, they're restricting COVID vaccines, right? You need a prescription. I don't understand why they're doing this because to get the COVID vaccine, it's a voluntary process, right? You go if
Always
you
been
want it.
voluntary.
Yeah. And so
Not in Georgia.
what i-
Not here.
what is the point of putting in these restrictions, right? Like,
The irony is not lost on me that the group that is screaming about medical freedom and autonomy and independent thinking and medical freedom to choose is actually restricting that. If they're removing medical freedom, they're removing informed consent. They're doing that right now with the hepatitis B birth dose. And it's not based on evidence. With COVID-19, they wanted to restrict access to people who are 65 and older and immunocompromised. They also didn't want it to give it to pregnant people. But if you paid close attention, the very paper that they published, I think in NEJM, the New England Journal of Medicine, included pregnancy as a comorbidity. But if you also look at the long list of comorbidities of those high risk factors, about 75% of Americans fall into that category because it includes things like sedentary lifestyle, depression and anxiety, including obesity and diabetes, which many people in this country fall into those categories.
Yeah.
So it's not logical that they would do this. It's not, it is just part of an agenda to discredit vaccine science because it wasn't just about COVID, right? It's about COVID and then HPV and then MMR and then Hep B, and they're going to go one by one through all of them on the chopping block. And that's why decisions like the AHIP, which is the largest insurance group, yesterday said, despite what we hear from ACIP, because typically insurance coverage is determined based on ACIP decisions, they said, we're going to go ahead and make sure that COVID-19 vaccine will be covered at no cost through the end of 2026. They had to preempt ACIP and say that because what they're anticipating is what we're talking about here, restricted access.
Unreal. Unreal. What else do you think is going to happen over the course of the next 3.5 years? What other things do you see on the chopping block or being targeted by this administration that you get worried about?
Yeah, I mean, I think the hepatitis B birth dose is going to disappear. I think they're going to delay the recommendation. And that is catastrophic because we have had two vaccines in the history of vaccines that prevent cancer, HPV and hepatitis B. And we know that if an infant before they turn 1 is exposed to hepatitis B virus, they have a 90% chance of developing chronic hepatitis B. Chronic hepatitis B can lead to cirrhosis of the liver and hepatitis or liver cancer. And it just makes no sense to make that decision because it has been vilified as a STI only. When we know that there can be exposure from non-sexual contact, including with children. We're anticipating that. We're anticipating HPV to be probably on the chopping block. They're already making a decision about MMRV, which is not misaligned with what's already been decided. This decision last month to remove thimerosal from vaccines is not a step in the right direction. It's just showing like ideology over evidence to make decisions. And so I just think we're going to be seeing a more a la carte experience with vaccines, kind of like what Florida has decided. You can choose your own adventure.
Roxana, what about you? What do you see on the chopping block next 3.5 years, or worried about the next three and a
well,
half years?
I'm worried about occupational health and
Mm.
safety, right? The National Institute of Occupational Safety and Health, NIOSH, has pretty much been eliminated. And so, how are we going to take care of our workforce? How are we going to protect them? How are we going to stay on top of like emerging issues? And we spend so much time at work, right? And so now that all that is pretty much gone.
Mhm.
And I think that and all of these rollbacks by the EPA about hazardous uh, exposures, it's just, on the one hand, you have over here uh, one group, Robert F. Kennedy, who's really concerned about environmental exposures and all of these dyes and everything here. And then you have over here at the EPA where they're just like rolling back everything, just exposures everywhere to go. So to me, it's just like it doesn't make sense, like what it is that they're aiming to do, how these things are going to keep people safe and healthy.
If
Do
it
you have?
doesn't make sense. And chronic disease epidemic, that's for sure. Because when you eliminate a disease that eliminate a vaccine that prevents chronic illness, to me, that doesn't seem like making America healthy again.
Do you have a take on why they're doing this, Jessica? I mean, at best it sounds like God. At best it sounds just dumb, right? And at worst it sounds cruel. What is it? What where have you landed on why they're doing this?
A lot of the people who have been on this movement have profited greatly from this type of grift, from
It's
this
about the money.
platform. And it's again very disingenuous to have claimed that previous ACIP members had conflicts of interest, when if you look at the conflicts of interest represented in the current ACIP members, it is astounding. And so it is profitable to make this kind of movement grow. If you compare dollars to dollars, the wellness industry is so much larger than big pharma. And I am not a big pharma evangelist, but I can understand that a very corrupt and capitalistic driven corporation and groups of and corporations that create these products can be both problematic and create life-saving tools for population health. Both things can be true. And so I think profit is behind it. I think fame and glory are also very, in a twisted way, a primary driver. I think RFK Jr. has had his eyes on this position for decades. I've often said I wish he was dumb. He's not. He's very strategic. And this was a plan from the very beginning to come in and be in the highest position of power of public health in America. And that kills me, is that he will always have that title. He will always, no matter how long his tenure is, he will always be a former HHS secretary in this country. And that frightens me for what it establishes him as a voice of authority, as a man with absolutely zero experience, who has pathologically lied, even under oath, to lawmakers about his intentions and about what he promised he would and wouldn't do.
I'm so grateful you called that out. He did lie under oath, and it seems to me that people saw his last name and it was the Kennedy last name. And that does a lot in this country. He is one of the large political families. He comes from a large political family, right? And people saw that and they equated that with JFK. They equated that with his father, and they voted for him, or they endorsed him, or they backed him. Are you guys worried at all? I want to pick up on this and tug at this thread of wellness, because I've spent a lot of time traveling the country recently in this independent role. I spent a lot of time with the younger generation, right? I was out in the Central Valley hanging out with some varsity football players. They pick grapes in the morning and they're going to play football in the evening. And hanging around these guys, the locker room talk, it became so evident to me that they look up to guys like RFK Jr. and Trump. For whatever reason, they see something in them. They see, the tough talk, the gangster kind of, rolling around, doing what I want, always getting away with what I say I'm going to get away with. RFK, wearing some cool gear, some Acer Techs. I don't even know how to say the label of the name, but they were talking about this brand of clothes that he was wearing. They're talking to them, or they're looking at them like influencers, not so much like people that are politicians or setting laws. And that really stood out to me. And I wonder if you guys see it yourselves in sort of the youth now and them looking up to these folks.
Yeah, I don't think people are looking for expertise anymore. They're looking for power and clout and followers and influence. It's not about expertise anymore.
Roxana?
Well, I am an assistant professor at Emory University, and I would say that the students that I interact with seem to really understand and really do believe in science and expertise,
That's
and
great
they
to hear.
themselves are here trying to get that expertise. And I have a lot of hope for the future.
With your students, have you seen this sort of disinformation campaign or this wellness, the popularity of it? Have you seen some of these pop culture themes uh, show up in the questions or sort of the discussions in your class?
Well, I mean, yes, but they don't, go overboard with it, right? Like they might want to eat organic and be healthy, but it's in moderation. It's them really understanding science and not understanding what wellness and a fab is and what's trending. Uh, but I think that critical thinking is really needed right now,
Yeah.
and something that we need to continue to strive to inculcate into our students from a very young age.
Yeah.
And so that they don't get sidetracked by all these influencers that, I used to think that, intelligence was power, right? But now it's just like an influencer can have lots of power. And
That's
it doesn't
right.
matter what they say, right? Like, it's just they're an
Mhm.
influencer. Like, power is to be an influencer.
That's
Who's
right.
shouting the loudest in the room? Who's
Yeah.
who's the loudest person in the room? Do the kids still want to go work at the CDC?
Well, I yes, this is what I tell students, and that is, when it comes to public health and all of this, if you are happy with what is happening right now with public health, then this is your moment to get in. And if you are unhappy with what is happening with public health, then this is also your moment to get in and, you know, help things go to the direction, whichever direction it is that you are for. This is the time public health needs you.
Yeah, yeah. I worry about. I talked to so many people in public health before coming in here, before coming on with you guys, and one of the points that a CDC employee currently wanted to make was that there is a distinction between those with the political ideology at the CDC and those who have been there a long time and are really moving in good faith. And if I could read a comment from them, they said, selfishly, I'd like to point to come across that there's a difference between the career scientists and epidemiologists at the CDC versus the political staff. A lot of things are being forced upon the CDC. There were recommendations that were advertised as CDC changing its recommendations, but in reality, it was HHS making the change with no input from CDC experts. So the damage is being done to the
Yes.
reputation of the CDC. And these are lasting impacts, Jessica.
Yep, absolutely. I mean, that came up yesterday during the hearing. It broke my heart when Deb Hurry was saying that she found out about vaccine policy changes the same way that everybody else did, through social media. They had been completely bypassed and had not been spoken to, and in fact were instructed not to speak to anybody but political appointees. Any of those career scientists were iced out of conversations, were kept in silos outside of any sort of protocols and decision making. And that is not how we do science. I mean, if we're talking about transparency here, if we're talking about gold standard science, there's methods that we have established to do that. And all those methods right now have just been thrown out the window. And it's deeply troubling because now we know that it's not actually about experience and intelligence and reputation even in the sciences. It's about, do you already agree with me? And are you going to just say yes to what I say? And
Well,
that was
Roxana,
proven yesterday.
Roxana, it's crazy because you have the CDC director, Jim O'Neill, saying now we're unconstrained, by the WHO. We're unconstrained now by this agency that is one of the gold standards. Like, that's scary to me, to an American here, listening to an agency, a director of an agency that should be giving me hope, making me feel good, making me feel like I'm in good hands and I'm gonna be okay.
Yeah, and it's ironic they're actually more constrained now, right? Because you
Yeah.
have to follow what that one person wants. And if you don't, then goodbye.
Yeah.
So,
How can we help make sense of this, and how can we help communities protect themselves? This question is open ended for either one of y'all.
well, I think these programs like this are really important where people can actually hear a conversation and make decisions. And, there's nothing that's really um, off limits to talk about, right?
Right, right.
And and so you're bringing really good people onto your show who can really talk to communities in a way that they can understand. I think that's just continue to talk about it and continue these shows.
Well, I
Yeah.
feel like, independent media is more important than ever. We're doing this a day after Jimmy Kimmel was sidelined indefinitely. We're doing it weeks after Stephen Colbert. You see what anchors are saying now to bend every which way to try to get Trump out of the Epstein connection and Epstein files. You see what's happening.
Yeah.
The conglomerization of media, the FCC really allowing Tegna and Nexstar to own as many companies as possible and to just basically have a runway for state TV. And so
Yeah.
I meant that when I said the parallels between what we have in the media and public health. So the question now to you, Jessica, how do we help better prepare and protect our communities right now?
Yeah, I mean, supporting independent journalism is as important as supporting independent science communication.
Right.
And there are many, many people like myself who are trying to do this in our, air quote free time, in my day jobs and my 3 kids. I'm trying to make as much content as I can that is freely accessible, that is not paywalled, because I think that science and public health belongs to the people. I think that the only way that we can have individuals making informed choices that will then have a ripple effect in their communities, because that's basic public health, right? We don't just get vaccinated for ourselves, we do it for the people around us. And all those collective decisions are how we see better, healthier, thriving communities. I'm going to keep doing this work. As painful as it is some days, I'm going to keep doing it. And I need folks to continue to amplify it and support it too.
I mean, I'm so grateful that you're in my life. We got connected between a mutual USC friend, contact there, and we have been able to stay in touch this last couple of years. I'm so grateful for your time, guys. You, Roxana, and Jessica. I ask everyone that I interview at the end of our interviews, is there anything that I haven't asked you that you think is important to know, or anything that you guys would like to speak on? Now's your chance. Roxana, we'll start with you.
Talk to your healthcare providers,
Mm.
and they will give you good advice. That's what I think.
Punto.
Yeah.
And any message for the Latino community out there? We have a lot of viewers. We started this on immigration. We're expanding to public health. Any message to people that might be watching this, who worry about what we're hearing, for instance, in Utah, is people who are pregnant who are not going to go get care. People who are scared of going to their doctor's appointments because they're worried about getting picked up. Any message to the undocumented that are maybe watching this?
Well, I think that one, we cannot live in fear, right? And we cannot let this administration take our joy away. And there are many organizations out there that I think are very aware about potentially ICE showing up and are sensitive to that. And it's just about finding those organizations. So some low cost clinics, some community clinics that are out there, and talking to your healthcare provider and making sure, like, how can we make this, accessing you safer, whether it's like maybe doing telehealth or, figuring out how these providers also know what are the rights of patients
Right.
when they go into their offices. So I say to the Latino community that we must, seguir adelante, adelante.
Adelante. I love that. Roxana, thank you so much. Jessica, floor is yours.
I would agree. Like, continue to stay close to your provider if you have one, but also talk and call your representatives. Those people work for you. They represent you. And I'm going to keep screaming on the internet that we have to be calling them and let them know that this is not what we want for our health, for the health of this country, and even for the health of the world. America, as much as it wants to be isolated, is not isolated. We are too connected in this global world. We saw that through COVID-19. A disease somewhere else can be a disease here. And our decisions that we make, from the, money in our budgets that we approve to the decisions that are happening in Atlanta for the CDC, have global implications. So keep calling your reps.
Thank you guys, the both of you, so much. There's so much to be grateful about. And I just love showcasing powerful, strong women. I love the examples that you set for my daughter. I mean, these are the kind of people that we celebrate as heroes in our household. The two that you just heard from today. I'm so grateful for your time. Roxana Chicas with the nursing school at Emory University, and Jessica Malaty Rivera, leading epidemiologist, science communicator. Thank you so much for taking the time with Nick Valencia News. We appreciate it.
Thank you, Nick.
All right.
Bye.
Got to drop off here. And we're going to get on to our next guest. That was awesome. That was terrific. What a terrific conversation with two amazing women, two amazing public health professionals, people that are really making a difference in this country when it comes to making our country healthier, having the opportunity to make educated decisions when it comes to your health. And, they're people that you should follow. Roxana is somebody who I was just introduced to over the course of the last month after we started this. She's a friend of Samuel Aguilar, who was on here with A&R Strategies. If you guys remember him as a guest, that's a friend of his. That's how we were connected. And Jessica Malaty Rivera, just a star. She's amazing. We want to move on here, though. We had a guest that was going to join us here as part of the Women's Refugee Commission. I talked to you about this at the start of the show. The WRC is doing some one of a kind work. They are and have launched a detention pregnancy tracker. You know how hard it has been for families to keep track of their loved ones while they're in this immigration detention system here in the United States under Trump administration 2.0. They recently started this. And so we want to have one of the heads over there at the WRC join us now. While we get settled here. I need to find their name. Good gracious. I think I saw them in the chat. And let's see here. Where are you guys? I see Dr. White. Dr. White's going to join us here soon. And then Sarah Massey. Sarah, if you can help me find, I thought I saw you in the chat a little while ago. Can you help me find our next guest's handle? I don't think I ever got it. I don't think it was ever sent to me. So if you guys don't mind, there's Zane. There we go. Hey, Zane. All right. Let me get Zane on here. I love how casual this all is. LA la. There we go. Invite. And here we are. Hopefully that'll happen soon. We're waiting for Zane Lakhani with the Women's Refugee Commission. Also, thank you guys so much for everyone in the chat. Mike Kaufman, Natalie Hernandez, and everyone else. Hey there. Hey, Zane. How are you? Welcome to the show.
Hi, it's such a pleasure to be here. And I'm sorry, I feel like I've got a little bit of challenges with my text setup. So
are you kidding? We started the show about 7 minutes late because I couldn't even get on live here. So
we are just doing the best we can.
Do you know what I've realized though, Zane, is that the folks that watch this and that are fans of independent journalism, they want to see all this stuff. They want to be with us through like the technical hiccups and like the rawness of it all. They kind of want to see how it all comes together. So I'm learning this as I go along. Zane, thank you so much for the work that you're doing. If you want to just start by giving a short introduction of who you are and your organization's work and what you guys are focused on right now.
Sure. Thank you so much. And thank you for, giving us the opportunity, to come on your show and to talk. And it's such a pleasure to have followed the robust conversation. I very much enjoyed it.
Thank you.
So my name is Zane Lakhani. I am with the Women's Refugee Commission. I direct the Migrant Rights and Justice Project, which is our domestic policy and advocacy and research division. We are, both a global and a domestic U.S. kind of research and advocacy organization that is specifically focused on the rights of migrant and displaced women, girls, and families. And the Migrant Rights and Justice team, which I lead, is the only national organization that is principally dedicated to ensuring the rights, needs, health, and safety of immigrant, migrant, and women and girls in transit to the United States, at the border, and inside the United States. So that's a little bit about kind of where our background. We've been around for about 35 years. Originally we're part of the IRC. And I just to give you a sort of just an overview, a little bit about what we're focused on. We are working very hard on immigration detention, particularly focused on pregnant, postpartum, and lactating women, sexual assault and abuse, and the other harms that migrant women are experiencing in detention. We're also really working hard to try to understand the way in which migrant women's access to sexual and reproductive health care in the community outside of detention is being impacted, especially by immigration enforcement and, the criminalization of access to women's health care. And also really focused on what I've been calling the new family separation crisis, or family separation 2.0. That is, ripping families apart in a wide variety of ways, including by detaining and deporting parents without giving them an opportunity to reunify with their children.
You said so much, but one thing that really stood out to me is the criminalization of access to healthcare for migrant women. Talk to me about that. Speak on it.
So, it is going to be no surprise to your audience that we've been experiencing in the past several years a crackdown and criminalization on access to sexual and reproductive health care in many parts of the country, right? The Dobbs decision is merely one example, and there's been many, many others at the state level that really demonstrate that for many, many women, access to sexual and reproductive health care is very, very difficult and often criminalized. I think one of the things that many people may not necessarily recognize if they live in a state that protects their access to sexual and reproductive health care, and they are US citizens, that their undocumented neighbors are living a very similar life to a woman in a state where sexual and reproductive health care is either extraordinarily difficult to obtain or is criminalized. Right. So, they may not recognize that their undocumented neighbor is afraid to go to a hospital if she's experiencing a life-threatening miscarriage, is afraid to go and receive pregnancy-related health care, is afraid to walk into a hospital for any reason. Really, her child is having an urgent healthcare crisis because she's afraid that ICE is going to detain, arrest, and deport her there, right? She's afraid of immigration enforcement in that setting. And so really trying to understand, I know that this came up at the very end of the last conversation, right? How it is that women are interacting with the healthcare system or feeling like they cannot interact with the healthcare system, immigrant women, because of their heightened fears of immigration enforcement. And this is really functionally hampering immigrant women's access to reproductive health care across the country. And it is, of course, worse in places where sexual and reproductive health care itself is also subject to increasing forms of criminalization and surveillance.
Places like Utah, which is a very red state. And we met with Linda Stone from Moms Rising. And in our conversations with her, Zane, she told me that she knew of at least one pregnant woman who delivered at home and refused to go to the hospital because of her legal status. I mean, you have so many fears happening right now. What are you guys doing to remedy those fears? You can't convince people that they're safe in a country that's literally singling them out. What are you telling them to make them feel better?
So that's a really important question. And that's a little separate from the kind of pregnancy detention work that we're doing. But I think one really critical tool in order to help address and remedy these fears is to work at the state level. State and local legislation, state and local policy has an enormous amount of power, to be able to help reinstate some of these protections. So WRC works very closely with other organizations to, for instance, reinstate at the state level or to move legislation at the state level to reinstate protections for what used to be called sensitive zones or protected areas, right? Which is basically just locations that are identified where ICE is not able to go in and detain and deport and arrest people there, right? So hospitals, domestic violence shelters, schools,
Churches,
children play. Exactly. Right. So there's an enormous amount of power that state governments have to enact these protections. Data privacy is another very powerful area where states have a lot of ability to enact meaningful protections to prevent places like hospitals and other sensitive locations, schools, from sharing data with ICE. Right. So, I think turning to state and local governments and state and local government policy is one very, very powerful tool that is available right now for creating safety and protection. And then, of course, know your rights training, community education, right? We are out there on a regular basis, as are many, many other organizations, right? Working closely with migrants and migrant families to do the vital kinds of know your rights training to help people understand what rights they do have and what to do if they are stuck in a situation where they're encountering or may encounter detention or deportation or enforcement.
Wonderful. Thank you so much for that. If you're just joining us, you're joined by a representative of the Women's Refugee Commission, and we want to talk specifically about the data pregnancy tracker. I was fascinated that this even exists. I was fascinated that you're dedicating a portion of your team to this. How big of an issue? How many detained pregnant women are there? Tell us about the current state of it.
Nick, you are asking incredibly important questions, some of which I can answer, which is why it is that we're doing this work, and some of which I can't, which is how many detained pregnant women are out there. And that's part of the point of this tracker. So I will just say, I'll spin us back a few years. Since 2021, the U.S. has had policies in place that counsel against very strongly detaining pregnant, postpartum, and nursing women, right? Recognizing that it is very unsafe for women who have such advanced healthcare needs and nutrition needs and other, just needs to be in immigration custody, right? And so we counsel very strongly against these women being detained. U.S. policy has done that since 2021. I'm just going to shortcut it and call it the 2021 Pregnancy Directive. It has a much longer title. But and if they must be detained, it imposes strict requirements on the kind of monitoring that they must be subject to, weekly monitoring and reporting to ensure that detention is still appropriate for them. It requires that they be detained in suitable facilities for their mental and physical health needs. And it has all kinds of requirements on what constitutes appropriate care to ensure that they receive appropriate care. And over the past several months, WRC has been receiving reports that this is just absolutely not being followed, right? That there are substantial numbers of pregnant, postpartum, and lactating women being detained. I'm sure you and many of the people watching this live stream have seen the reports by the Senate Judiciary staff or by Senator Ossoff's office that also went into facilities and was just revealed not only just the shocking number of pregnant women who were detained, but also the appalling conditions under which they are being detained, right? WRC has received reports of pregnant women being held in facilities that are so overcrowded that they're being forced to sleep on the floor, of begging to take an apple and a carton of milk back from the cafeteria to their cells and being denied and being forced to try to meet their nutritional needs through, the amount of, these $6 bags of Doritos that are available through the commissary, right? The only food that's available, frozen burritos and potato chips, and just things that are completely inappropriate for a pregnant woman to be consuming to sustain herself in a healthy pregnancy. WRC recently, in partnership with the Washington Office on Latin America, went down to reception centers across Central America and Mexico to sit in these reception centers and talk to migrants as they were being deported coming off the planes and to talk to shelter and service providers. We encountered lactating women who were so malnourished from their time in detention that their bodies could no longer produce milk. This is the level of mistreatment and malnourishment that these women are experiencing, right? These are just absolutely grievous conditions. Women being left alone to miscarry, for 24 hours begging for medical attention or for even some water and being denied, just in acute pain, sometimes for months being denied access to medical care, absolutely atrocious conditions for pregnant, postpartum, and nursing women to be detained in. And one of the really significant problems, though, we know these violations are happening, but immigration detention, as you well know, has turned largely into a black box, right? All of this is happening under a shroud of darkness. We used to be able to go into detention facilities, speak with migrants, do know your rights training, and learn about the conditions, escalate concerns or complaints that they might have to the Office of Civil Rights and Civil Liberties and Immigration Detention Ombudsman, which were the Department of Homeland Security's own oversight agencies, which they have effectively gutted over the past 6 months, right? Nobody's inside these facilities doing the kinds of monitoring that we used to have. We have lost previously required reporting to Congress that would give us all kinds of information, including the number and treatment of pregnant detainees, right? And we just no longer have access to sort of pierce behind the veil. I'm mixing a ton of metaphors here, but like pierce through this black box where all these harms to women and extraordinarily vulnerable populations are happening with impunity. And that is part of where the detention pregnancy tracker came from. It's in the chat. I know you can find it at detentionpregnancytracker.com. We were hearing all of these reports, but knowing that we really need a systemic and comprehensive understanding of what is happening across the country, right? So this is a confidential reporting tool, the first of its kind, that's going out nationwide that asks healthcare providers, or that allows healthcare providers, attorneys, service providers, religious workers who are going into detention facilities, to be able to submit confidential reports about pregnant, postpartum, and nursing women that they encounter, so that we can engage in evidence-based advocacy, so that we can fight for these women to receive better treatment and care.
Saying God, the stuff that you're saying just makes me emotional to think about. I have 2 small kids. Think about my wife when she was pregnant and how difficult it was. And she had a great pregnancy, and she had everything that she needed, that she desired within her reach. We get to that point where you're pregnant and you're going to the doctor every week, right? And I can't fathom or imagine that we have people in custody, human beings, that we're treating like this because somebody has labeled them illegal, because some man-made construct has drawn a line and said, hey, once you cross this, you're a felon, even though it's not. And they're being treated like the worst of the worst,
Mm-hmm.
With this one-of-a-kind tool. How skeptical are some of these migrants in custody to be more vulnerable? I mean, they're probably so traumatized. The last thing they're thinking about potentially is themselves. It's just sort of out of sorts. I don't know how forthcoming are they with the details about what they're going through.
So a lot of what the detention pregnancy tracker is doing is it's working with attorneys and service providers and healthcare workers, right? Allowing them to submit confidential reports. I work with a lot of attorneys and service providers, across the country because clients want to be able to report and they want help and assistance, right? They are desperate, to be able to access the vital healthcare, nutrition, to be released from detention, right? To get the care and services they need. Of course, nothing happens without the consent of people who are sort of in this situation, right? But my experience has been that a substantial number of immigrants, if they are given the protections of anonymity and non-identification that they absolutely require to be safe, do want to be able to have a platform to be able to reveal what is happening to them and, to be able to work in partnership with their lawyers and with advocacy organizations to get that information out there and to fight for themselves to receive better treatment.
What are the challenges that the WRC has in this prevention or data tracker, this pregnancy tracker you're talking about? They're not playing by the rules. They're not allowing immigration attorneys in. They're not allowing members of the Flores settlement or Flores agreement to go be, to look at what's going on in there. So how are you even getting this data collection?
Yeah, that's such a great question. And that is why the tracker itself is targeting service providers, healthcare workers, religious workers, people who have other interactions and who encounter pregnant women who are in detention or immigration custody, right? And I don't want to just imply or sort of suggest that this is just ICE detention, right? We're looking at a wide variety of detention facilities. Immigrants are being held in state and local jails. They're being held in all kinds of, interim or temporary processing facilities, right? So all, to do with immigration. But in immigration custody, there's a wide variety of facilities, some of which are significantly less suitable than others, some of which we see people being held for weeks at a time in facilities that don't even have showers, right? They're not meant for long-term detention. So, we are working and the tracker is really picking up on the many, many different kinds of service providers, attorneys, legal service providers, workers, healthcare workers, especially. I really want to emphasize that, who do come into contact with people in detention systems, right? If you are a woman who goes into labor or who has an urgent pregnancy complication inside an ICE detention facility, ICE is supposed to transport you to a local hospital or medical clinic where you can receive appropriate care.
Right.
What was supposed to happen. And people in those settings are able to work with, to help provide information, anonymized information about the treatment, the medical conditions, the problems, the concerns, the malnourishment, the fears of detained pregnant postpartum women that we are seeing. But I do want to stress this is only one tool, and it is absolutely shocking, as you have said, that we need a tool like this, right? It's just unbelievable. My colleague at WOLA has said many times when we were down doing this trip that it is, we had to go to 5 different cities and 3 different countries to learn about what is happening in our own. It is absolutely crazy that this is the world in which we are living, and that we are forced to kind of try to cobble together, and WRC is working very closely, for instance, with members of Congress and other forms of, other ways in which we can get transparency. You may have seen Senators Blumenthal and Murray released a letter this morning, calling for an end to detaining pregnant women, but also urgently requesting information about their treatment and care. I mean, we are just using every single innovative tool that we possibly can to try to get information, which is just not at all the situation that we should be in, right?
And it's our audience. Some of these folks are going in and out of detention. Some of them have people that are detained in custody right now, from Alligator Alcatraz to Puerto Rico to Henderson, Nevada. There are people here who are impacted directly by this. For those that want to keep up with your work or potentially add value to what you're doing, how do they get in touch with you?
Yeah, so you can get in touch with me very easily. Go to the Women's Refugee Commission website. You can link to the tracker there. You can also find my email address there. Please feel free, to drop me a note or to drop one of my colleagues a note. We have my team, the Migrant Rights and Justice team, has an email address, mrj@wrcommission.org. You can also email that as well. We really encourage people to get in touch. We are, really delighted to work with you. I would also say, please fill out the tracker. Please do. Yes, thank you, my colleague Sarah.
Sarah Massey, they just put it in the chat there.
Are you can find out a ton of information about what we're doing there, and you can get in touch with us anytime. You can follow us on social media, of course, all the standard tools. I will also say that anyone who is watching this podcast, watching this live stream, there are an enormous amount of tools at your disposal, right? I believe that one of your previous guests mentioned speaking with your representative, your members of Congress, right? These are people who need to hear about how you feel about what is happening to immigrants in your communities. These are also people in your communities, right? This is your neighbor. This is the person who works at your local shop, right? You can sort of work at the state level to try to push for legal and policy change at the state level. You can talk to your representative and ask for, detention, oversight, legislation, policy change, right? These are all tools at your disposal for people to stand up and fight for these vulnerable women and girls in their communities.
Before we move on to our next guest, who's been patiently waiting, I want to make this point. I covered family separation. I saw the kids in cages. I saw things that I'll never forget. And I came away from there, Zane, believing that every person in this world has the right to dignity and integrity, and every child should have the right to be nurtured and loved. And the fact that we have pregnant women who are some of the most susceptible and vulnerable when it comes to health, we're focusing on public health, the care that they need that they're not receiving simply because somebody has blanket termed them something and wants to treat them like an other or less than human. Think of this. We all come from our mothers. We all come from a pregnant, it's common sense to treat people who are vulnerable well and to have compassion.
I could not agree with you more. Surely this is an issue that we can all agree on, right? That a pregnant woman needs access to healthcare, to food, to safety, to dignity. Surely these are issues that we can all come together and agree on.
Conservatives, Trump, they say they care about kids. I certainly do. They're the most vulnerable.
Mm-hmm.
This is why we're here. Part of the reason, I believe, and it is so upsetting. There's more that needs to be done. I want to follow up and do a story on you guys. Before I let you go, though, Zane, and move on to our next guest, is there anything that I haven't asked you that you think is important to know, or anything that you'd like to talk about? Now's your chance.
I will just touch very briefly on something that you said right towards the end when you talked about family separation. And I think I flagged this right at the top, but I just want to emphasize for all of the viewers today that in an adjacent sort of issue that WRC and many others are working on also, we are finding ourselves in the midst of a new family separation crisis that is in many ways, just extremely pernicious because it is so invisible, right? It is happening through immigration enforcement in cities and in towns, with the rights and needs of parents being complete and policies in place to protect parents to ensure that if they're facing deportation, they can bring their children with them, being completely disregarded. We've encountered, again, through this trip that we took down to speak with people in the reception centers, parents who were showing up inconsolable because they did not know they had not been allowed to bring their children with them. And some of them didn't even know where their children were. They'd been picked up in grocery stores, in courthouses, in school bus stops, and just were absolutely terrified because they didn't know who had their children, or they needed to be reunified with their children and didn't know how that was going to happen. So that's another conversation. That's a longer conversation I would love to have with you, Nick, but I just want to sort of make sure that we kind of touch on that briefly as well, because that is another just grievous crisis that we are in the middle of with, again, families being torn apart, with children being left, without their parents who they urgently need.
Zane, I'm glad you touched on that. There's still hundreds of kids that have never been reunited with their parents. I tried to go above and beyond in those days of family separation and on my, quote unquote free time, trying to. I know that we connected at least 3, if not 6 families and helped them reunite together. And that's something that when I die, I'm going to be so proud of, that I helped connect kids with their parents. And the fact that I even had to do something like that, the fact that you're even having to do the work that you're doing, I don't know, it just makes me very emotional and very upset. And I'm so grateful for everything that you are doing. And I'm so grateful for your colleague, Sarah, reaching out and connecting us. Thank you so much, Zane, for taking the time with Nick Valencia News.
Thank you, Nick. It was a real pleasure to be here and to talk to you and to reach your broad and powerful audience. We really appreciate it.
Oh, God bless you. We'll talk soon. I'll be in touch. All right.
Thank you. Sounds
You got it, Zane. That's Zane Lakhani with the Women's Refugee Commission. Thank you so much for taking the time. We'll let her go. And we're going to wrap up the show with 5 good minutes. 5 good minutes with our boy, our man, our homeboy in Alabama. Thank you so much for hanging with me here. Let me see if I could find you. HBCU Legal Fund. Legal Focus Group, is that you? I'm going to invite you in. Here we go. HBCU Legal Focus Group. I'm pretty sure that's you. That's Dr. Robert White with the HBCU Legal Fund. He's going to come on and help us wrap up the show. Great show so far. We had, if you guys are just to recap here while we wait for Dr. White, we had Jessica Malaty Rivera, we had Roxana Chicas, we had Zane Lakhani, and now the man, Dr. White. Thank
How
you
you
so
doing,
much
Nick?
for taking the time with us. I appreciate you coming on.
Man, I'm happy to be here, man.
All right, let's get right into it. I want to know, because we wanted to talk about this conversation we had back in April about bringing the Black and Brown community closer together. That there are so
Yeah.
many parallels between what you talk about with civil rights and being there in Montgomery and what our community is going through right now. I would love for us
Right.
to be the example of bridging the gap between our communities. There's more in common than we have dividing us. Tell me, tell me what's going on right now. Tell me how you have sort of seen those parallels and helped, spread the message about what we're going through and seen the impacts on your community as well.
Well, Nick, first of all, thank you for allowing me to be on. And I will say that I did enjoy the conversations of the guests that you had prior to me. And I will say that there are two fights that we have to deal with. One is the rift on college campuses between STEM and social science. And listening to the STEM people gripe and complain and moan and all of those types of things, from someone on the neglected side of the campus, the hood side of the campus, the ghetto, which are the social sciences, we say good, great. Because for so long, them STEM folks who are very bourgeois elitists have hogged the show, taken all of the grant money, all of the attention. They have plush offices. Did you see how beautiful their offices were and stuff?
Oh, I saw.
Nick, I'm in a broom closet, okay? See, if you teaching humanities or you anything in the social sciences, you are the red-headed stepchildren of the university. And so all of the problems that they have, and I say good. Until they decide. They're arrogant. They're arrogant, Nick. STEM has gotten all of the money. They get all of the research stuff. But one of the things that COVID revealed was that while they had the money, they did not know people.
Mm.
They could not come up with a public relations model, which we talk about,
Yeah.
on how to reach people.
Yeah.
Right? We don't deal with viruses and fungi and all that type of stuff. We don't deal with pathogens and all that. We deal with people. But those same terms that they use, right, in the sciences, we use in the social sciences. And we look at some family situations as a tangle of pathology. You see, same word.
Yeah.
So when you use the STEM vocabulary in social science terms, you get some solutions that won't reveal themselves unless you do that. So we got to bridge the gap at the university. Those STEM people gonna have to come off some of that money.
Okay.
You see?
Okay.
Did you see the latest? You saw the latest before? Man,
Yeah,
were
I
those
saw.
ladies not beautiful? They were beautiful.
They were all
Right?
of them. Yeah.
Their hair was done good. They had beautiful offices.
Is that the
You
grant
see
money?
what I'm
Is
saying?
that all the grant money happened?
It's the money. You see what I'm saying? See, they look like they got oil wells growing in their yard. Ain't nothing wrong with them.
Okay.
It's gonna be a hard sell for them to try to come up with look like they in an emergency, because them sisters look like they want an emergency for nothing. You see what I'm saying?
Well, what about you? What about you at Alabama State University?
Man, look, we hanging by a thread. We got to pay for our own trips to do research. If we write a book, we got to pay for it. You see what I'm saying? We can't. Nobody cares about us in the social sciences until you need something. Now you need a public relations model.
There we go.
Now you need a new now. African American humanities. Oh, now all of a sudden, oh yeah, we need to talk to the black folk now. Oh yeah, we see. Okay, all right. It ain't gonna be free.
Hey man, there are a lot of
You know
people
what I'm
hurting
saying?
right now. There are a lot of people hurting.
Because but you can't neglect your history, and when you forfeit, right, a certain part of your campus, right, when you don't include people in your conversations, you lose out. You lose out big time because, like I said, when it's time to talk about COVID-19, you ask the sisters that we just talked about. But when it's time to talk about people, you need to ask us.
That's right.
Because everything that we've discussed, Nick, we wrote the book on 30 years ago, but nobody cares. I can show you solutions to every problem that they brought up, and I can do it within a civil rights context because anything dealing with public health, you need to contact attorney Fred Gray in Tuskegee, Alabama. He is still living. He was the attorney for the plaintiffs in the notorious Tuskegee syphilis experiment, wherein it was exposed that the government was carrying on covert research operations in the Black Belt of Alabama using syphilis.
Yep.
He sued and he won. Now, you don't think that he can't bring? Yeah. Well, you don't think that he can't bring a case? That's right. You shared a panel with him at my class. That's right. That's right. You don't think he can't bring a case for reparations regarding the unequal distribution of the COVID vaccine and all of those types of things? You think that they don't have them? They do. They do have the machinery, Nick.
The answers are right in front of us. The remedy is right in front of us.
Exactly.
See, this is so beautiful. The history and the STEM folks getting together, and here we go. Here's a resolution. Here's a remedy. There's nothing new under the sun that we're facing, right?
Right.
There's nothing
but
new.
Nick, they're gonna have to come out of their ivory towers, Nick. They're gonna have to drop the bourgeois elitist man. They're gonna have to come and deal with the commoners.
Yeah,
with the
that's
little
part of the
nobody.
problem that you see right now.
Well, let me read to you and see. I have to, I've been in post-secondary for 33 years. Let me introduce something we don't want to talk about. It was a book, okay? It's called Propaganda. It was written by Edward Bernays, okay? This is the guy, Nick, that all of y'all guys want to be like when you grow up. He says this. He's like the founder of the public relations science, the science of public relations. He says, education is not securing its proper share of public interest. The public school system, materially and financially, is being adequately supported. There is marked eagerness for a college education and a vague aspiration for culture expressed in innumerable courses and lectures. The public is not cognizant of the real value of education and does not realize that education is a social force, is not receiving the kind of attention it has the right to expect in a democracy. Now, you can read that chapter. It's called On Education. And basically, he goes on and tells us everything that's wrong, right, with the education professional's perception of public relations, right? In my office, you won't see it because I don't want to embarrass myself. I'm surrounded by books and papers and files and stuff, right? And that acts kind of like as my shield, right? When students say I'm a peacock, so I have to make a nest, and I make a nest with papers and books and all that type of stuff. And most college professors will not leave their comfort zones to go out into the community and make relationships. See, that's the problem, Nick. The problem is that the universities got so isolated from the people when it was time for the people to stand.
Oh, Dr. White, his internet connection. Dang it. Dr. White, you're on a roll. Oh, brother. Is he coming back? He might be coming back. Dr. White, we're having trouble with your connection. Well, so it goes. Are you back? Here we go. Oh, you're back. Okay.
Yeah, I'm back.
My battery is dying here because I had to use my wife's phone. I'm like we're like 30 seconds away from sorry.
Yeah, and see, I get 30 seconds. See what I'm saying? See, this is what I'm talking about, Nick. I need some time, baby. You see what I'm saying? See, you know what I'm saying?
We're gonna invite you.
The other ladies there, I know they look better than I do.
No, it's nothing about how they look.
Very,
No, Dr. White, come
I know
on.
that.
Come
I
on,
know
Dr.
that.
White.
No. People,
Your
let me
internet
tell you why.
connection, I can't.
Let
It's
me tell
hard
you
to.
why. Public relations. See, public relations is everything. You see what I'm saying? Public
Doc,
relations is everything. See, scientists deal with the scientific method. You see what I'm saying? Whatever works, roll with it. But
oh God.
academics doesn't want to do that, and that's their downfall. You see what
Dr.
I'm
White,
saying?
as my
So
audience, as my witness, you're gonna come back and you're gonna have a whole hour to yourself. Okay?
no, I'm not, Nick. No, I'm not. No, I'm not.
What are you talking about? I'm the
We
boss
still
here.
friends. We still friends. I understand. I know this is my last go round with you, but I'm glad that I was able to come on the show, and hopefully y'all have fun trying to solve the world's problems. But
This
if you
is
want
not
some
your last
answers,
go
check
around
with the
on the
social
show.
sciences.
This is not your
Check
last
with the
go around
social
of the show.
sciences, baby.
We can't. It's hard. The
All
internet
right, man.
connection.
Listen, I enjoyed it. I enjoyed it. What's the ghetto internet connection? I'm telling you, this is a social science internet connection, baby. Sometime it works, sometime it doesn't. Hey,
we're
you
we're
know.
gonna we're gonna make this happen. We're gonna schedule up the next week. We're gonna do a whole show on Georgia. The week after that, I'm all yours, man. Tuesday and Thursday, we're gonna bring Dr. White back on. We're gonna focus on social sciences, or not social. Yeah, so the social sciences. We're gonna talk more. I want to just come on and have him introduce himself to get him, introduced to our audience and our viewers here. He's somebody that I talk to regularly, as often as I can. Somebody that's been a great mentor after leaving CNN. He's been somebody that I could have great honest, rigorously honest conversations with. So, Dr. White, thank you so much for coming on for a few minutes.
Brown power, baby. Brown power.
God bless you, brother. God bless you. Oh man, I wish we were able to hear him a little bit more, and I wish that his connection was a little better. We could have stayed on a lot longer, but also because you know that I'm having technical difficulties and we started this show a little late, I had to go off my wife's cell phone, and she did not charge her phone up because she did not think that I'd be on an hour and a half here. My phone is right here. You see, got my phone right here, and it's all charged up, but it wasn't allowing me to go live. What a great show. This was a fantastic show with guests educating us, giving us awareness about just what's happening with the state of public health in America. And I want to look ahead to next week. There's a lot to go over here, but I know I don't want to run out of battery before the show ends. Next week, we have another really, really big show, and it's a huge win here for us at Nick Valencia News. We're going to be hosting two of Georgia's gubernatorial candidates, State Senator Jason Estevez, as well as Olu Brown, who's a businessman. They're Democratic gubernatorial candidates. We also extended that invitation to former mayor of Atlanta, Keisha Lance Bottoms, but we never heard back. Jason Estevez, the state senator, has agreed to come on, as has Olu Brown. That'll be a live in-studio interview. We'll do them one at a time. It's going to be live at the King and Queen building north of the city in Atlanta. Not a studio audience. We're going to interview them one at a time, and we're going to hopefully collaborate and get those, get clips of that out there. And this is a really big gift for us here. I'm super proud that we were able to put this together, and that the candidates who did agree to be on our show, that they see the vision and they see the value that we bring here. And also to emphasize another really, a really big win for us here. We talked about this a little in the last show. We were reached out to by the Pew Research Center. And on November 6th, myself and hopefully my executive producer will be flying up to Washington, D.C., where the Pew Research Center will be hosting the inaugural New Media Summit. They've invited a handful of the nation's top news content creators, which I think I am now, according to the Pew Research Center. And they're going to get us all in a room together and see what new media is all about. You guys know this. You see what's happening with the mainstream networks. You see what's happening in the media today. We're on live here a day after Jimmy Kimmel was suspended indefinitely from his show. Stephen Colbert sacked from his show. You see what's happening at the mainstream networks all across. I don't need to tell you. I don't need to highlight it for you. You guys see it with your own eyes. Otherwise, you wouldn't be here. We are unbought. There's no sponsorship. There's no big money. There's no one behind us here saying, hey, say this, say that. This show is unscripted. These are my notes. You see? Got nothing written down here on my notes. Everything that we talk about is all off the top of my head. Questions that I think that you guys want answers to. Questions that I think are important to get answers to. If you guys like what we're doing here, if you see value in what we're doing, please consider becoming a paid subscriber. That's the only way this continues. That's the only way that we keep moving forward. Thank you guys so much for being part of today's show. Thank you for just your support. We're really, really grateful that you're part of this movement here and you're helping truth and you're making truth go viral. Thank you guys so much for joining the latest edition of Nick Valencia Live. Have a great day on purpose.